Okay, good day students. Let us start the dissection of neck. I'll be demonstrating the dissection of neck today, the practical session you have. So this in practical of neck, what we are going to do, at first let us see which part is the neck. So you know very well this neck is the cylindrical part of the body that is connecting the face and the upper part of the trunk, right. So now let us see what the structure inside the neck. We'll be doing the dissection today. So practical one. First you see that extension of the neck. From where to where this neck is extended. First you see this is the symphysis menti. Just follow this. Symphysis menti. And this is the suprasternal notch. I think you know very well. So this is the symphysis menti to this suprasternal notch. You know, just follow my finger. When I put my finger, I can touch the upper border of the manubrium. So see here student, so this is the symphysis menti and this is the suprasternal notch, okay. So this suprasternal notch and symphysis menti, just see my extension point. So from here to here actually anteriorly we are going to make an incision and I'll show you that how the neck is extended. First point I am putting here in the symphysis menti, in the upper limit I am showing. Then I am going following the mandible, the lower border of the body of the mandible, then the ramus of the mandible, then I am going to the mastoid process. So this mastoid process, after that you see here the superior nuchal line, and this superior nuchal line goes to this external occipital protuberance, right. So in the skeleton you see first that from here to here, so this is the upper limit of the neck. That means what the attachment will be getting, what the structures will be getting, that will be extended from this upper limit, what I am showing now. Now come to the lower limit. What is the lower limit? You see this is the upper border of the manubrium, then the clavicle, then the acromion process of the scapula, then the scapula, then it goes to the 7th cervical vertebrae spinous process. That means let us find out first, second, third, fourth, fifth, sixth, seventh. So these 7 cervical vertebrae until this is the extension of the neck we are seeing here. In this cadaver now, I shown here extension. So this is the limit of the neck. So here to here. Now I will be showing you the dissection point. First I will show the midline structure, then I will show the lateral structure. First I am putting an incision here in the symphysis menti and in the suprasternal notch, and then along the mandible one and along the clavicle one. Then I flap the skin laterally. You see here actually we have done the face incision also altogether. So now I am just lift the skin, flap the skin laterally, then I am seeing here the internal structure of the neck. But before that I would like to show you, if I put a midline incision, what the structures lying in the midline. First let us see, this is the symphysis menti, and if you see here a hard structure, a prominent hard structure, this is the thyroid cartilage, and in between here is the hyoid bone. If you see here, inside, here is the inside one, this is the thyroid cartilage and this is the hyoid bone over it. Just follow it, I am putting 2 forceps. This is the hyoid bone, hard one, and this is the thyroid cartilage. So if I tell one by one, this is the symphysis menti, then this is the hyoid bone and this is the thyroid cartilage. After that the cricoid cartilage, then we will be getting the rings of the trachea. You can see here, this patient has done the tracheostomy. You see, one tube is inside, that means you know very well. If we put one instrumental respiration, so we need to put a tube inside the respiratory tract. So this is called the tracheostomy if you are making a hole there. So this tracheostomy point we are seeing here, that means this part is the trachea. So all these structures we are getting in the midline. So one by one I am repeating again, symphysis menti, then one bone will be getting hyoid bone, then we are getting the cartilage of the larynx, that means the thyroid cartilage, then the cricoid cartilage, then the rings of the trachea. And after that we are getting here suprasternal notch. Now, how these hyoid bone, thyroid cartilage, cricoid cartilage, those things are connected. So, you see just at our neck, symphysis menti, then hyoid bone, in between two groups of muscles are there. In the upper part, these are the suprahyoid muscle that are making the floor of our mouth, and these two are the on each side the infrahyoid group of muscle. So now these are the midline structures, and I'll show you, I'll tell you and show you that what the level of this cartilage. You know very well, if you want to do this tracheostomy, you need to find out the trachea. So you cannot make a hole on the larynx, on the thyroid cartilage, on the hyoid bone, on the cricoid cartilage. You need to find out trachea. So how should we find out this thing? First, you know this hyoid bone is located at the level of the third cervical vertebrae. Then you see the first, second, third. So just opposite the third cervical vertebrae, we will be getting the hyoid bone. Then the fourth, fifth cervical vertebrae will be getting the thyroid cartilage. Then the sixth cervical vertebrae will be getting cricoid cartilage. And so, if you want to make the demarcation between the larynx and the trachea, you need to find out the spinous process of the cervical vertebrae. How you can do? In a living person, you need to find out, you need to examine the patient's backside of the neck, and need to find out one by one the spinous process. When you are getting the 7th cervical spine, then 6th cervical spine, make it easy, make it simple that at this level, larynx finished and trachea started. So you can find out where the trachea is there. Now, we got the relationship with the rings, with the cervical vertebrae, and we got the rings of the trachea. So, what the structures are related in front of the trachea? In front of the trachea, second, third, fourth rings of the trachea, we are getting here thyroid cartilage. You can see here on each side, just follow my forceps. This one, you see, this tube goes inside the trachea, and on each side we are getting glands. So just over it, the isthmus of the thyroid gland, on each side two lobes of the thyroid gland we are getting here. So these are the midline structure. Now I would like to make a summary. In the midline structure first, then we will go to the lateral side. So first, if we cut in the midline, we put the incision from the symphysis menti to the suprasternal notch, a longitudinal incision. Then along the clavicle, incision we made until this acromion process. Then we flap the skin laterally. And what the initial structure, upper structure we got the skin, superficial fascia. Then along with the superficial fascia, we got one muscle. I didn't tell earlier, now I am showing here. So this one muscle will be inside this superficial fascia. This name is the platysma. Then after that, we will be getting the deep fascia. Then when we cut this deep fascia, then in the midline, we are getting symphysis menti, then suprahyoid group of muscle, then hyoid bone, then thyroid cartilage, on each side infrahyoid group of muscle, then cricoid cartilage, then we are getting trachea and relations of the trachea, that means thyroid gland. So these are the thyroid gland, this is the thyroid cartilage, this is the hyoid bone, this is the suprahyoid group of muscle. I will show you all the muscles, and these are the infrahyoid group of muscles. Okay, so we got it in the midline. Now let us see what the structure laterally. In this lateral side, when we are doing the incision, same the things we will be making on the roof. That means, think my hand, I am putting here, this is the roof. My hand is the roof, you think. So this roof made by what? Skin, then superficial fascia, then platysma muscle, then deep fascia. These four structures is overlying the lateral side. If we cut all these structures, we will be getting the triangles, triangular areas in the neck. We called it the triangle of neck. Now, to make it very easier, I would like to show you the plastinated specimen along with this cadaver.